2, 1, and hello and welcome to our Friday webinar. We are back with Dr. Tom Tully with Ask the Vet. Hello, how's it going over there? You can hear me? Yes. Hey, so we have a holiday coming up, fast approaching, Dr. Tully. So question for you is, what is the official word on Thanksgiving feasts with your bird? Can they have turkey? Can they not have turkey?
Oh, I don't think it will hurt them much, but I know the turkeys are getting pardoned next week by the president in an official ceremony.
Yeah, I think their names are Peanut Butter and Jelly or something like that, are the turkeys' names.
Well, I guess so, you know, or Ferdinand the Bull or something like that. I mean, anything else to give other people ideas of what to eat possibly for Thanksgiving. But you know, but undoubtedly it was George Bush, the first George Bush, that made it an official presidential ceremony, although it had started earlier. But just a little piece of history trivia on that, you know, because you think it has been going on for quite a few years before, and it had, but it wasn't an official presidential ceremony of pardoning the turkeys.
Oh, that's fascinating. And are those, they usually like these big, are they like tom turkeys, like males, or is that what we're talking about usually?
I mean, they look pretty big to me. I don't know. Yeah. I don't know how they're selected, you know.
Have you treated many turkeys?
You know, not many, but we've done a little bit of research on turkeys, and the pathologists were, not happy, but we've treated a few turkeys, and what's interesting is that the turkeys we've treated have very, very interesting and interactive personalities, and they're rather large patients for us, and so we appreciate the variety with that. So, but we have treated a few, but not many. Many more chickens and ducks and geese and swans and you name it. But no, every once in a while we'll get a turkey in.
I'm trying to imagine the type of carrier you'd put a turkey in to take him to be treated, you know, like a big rolling dog crate.
A large one, yeah, very large. And we have carts to actually bring them back, because as you can imagine, macaws or something with large cages, you know, we have carts that are helpful in bringing the animals in.
Interesting. There you go. So I actually have are you ready for some questions for today?
Well, you know, remember we had dimethylglycine last time.
Yes.
You remember that?
I do. I'm glad you remembered it, because I remember it now, but I should have remembered it earlier, but you did. So now you can tell us that.
You know, again, we do our best to utilize the knowledge that we have to try to answer the questions, but this is a fact. We don't know everything, and we learn every day. And so the dimethylglycine, I believe, was used for prescribed for one of the birds, or recommended, and they were just wanting to know about that. And so it's actually an amino acid, and it's found in the body in a very small amounts and only for seconds at a time. So whoever found it had to be very good at finding something like that. And in humans, dimethylglycine, again, it's an amino acid, and it's used for attention deficit disorders, epilepsy, chronic fatigue syndrome, allergies, respiratory disorders, pain and swelling, cancer, alcoholism, drug addiction, and a partridge in a pear tree. So it's used for many, many different things. It's also used to improve speech and behavior in autism. nervous system function, liver function, the body's use of oxygen, and athletic performance. Some people use it to reduce stress and the effects of aging. I'm 100 years old and I've been taking it for years. No, but and as well as a boost to the immune system's defenses against infection. Dimethylglycine is also used to lower blood cholesterol, triglycerides, and to help blood pressure and blood sugar in normal range. So that's in humans. And as you can see, it's been used for just about everything. So therefore, that usually means they really don't know what it's actually effective for. So let's try it and see. In animals, it's a supplement that's used in a supplement that is often used as a performance enhancer in racing animals for its alleged ability to reduce lactic acid buildup and therefore its ability to reduce muscle fatigue. So again, apparently it doesn't hurt to take it, but as far as the scientific evidence of what it actually can do or will do is unknown, as we have discussed on other things. You can provide this supplement to the animal in birds and specifically of what we're talking about. But as far as its known effects and what you can count on it doing, it's unknown. So I don't think if you give it that it's going to do any detrimental harm based on what I was able to find. So there you go. The amino acid dimethylglycine.
Wow. That's a good deep dive that you did there. So thank you.
Yeah.
Okay.
So I'm ready for questions and we'll see.
Okay. So we have one from Ross. They have recently taken in an adult male orange-winged Amazon. And this is a question, I don't know if you've ever had one like this before, but the orange-winged Amazon every day likes to fly to their plants, both the indoor or outdoor in the aviary, and eats the soil. So they try to stop him, but he is very persistent. And so they want to know, is this dangerous for him? They're worried about, the aspergillus spores in the soil. And also they want to know, could he be lacking some minerals? And then that's why he's attracted to the soil. So that's a really interesting question.
Yeah, coprophagy is actually birds that eat their feces. Geophagy is when you eat dirt, and there are humans that do that. And of course, many of the attendees to the webinar today are familiar with the clay licks down in South America. We've actually done some work, not in South America, but with some biologists and ornithologists, biologists that have been down there. And so they're all interested in finding out why the birds go to these particular clay licks. And so you have this bird that goes to the soil and eats it, apparently. Well, there must be something within that soil that the bird likes, obviously. And so could it be a kind of a situation where the bird actually is desiring to eat that soil? It doesn't know why, but it's good, and he wants to eat it. And so is that due to some type of a mineral deficiency or something of that nature? It's possible. It's possible. But it would depend on what the diet is. And again, looking at diet, we've talked about that a number of times. If you're providing an adequate diet that you feel is diverse and would provide those vitamins and minerals, then it shouldn't be something that is deficient in. And so this is similar to a cuttle bone or a mineral block. Why does a bird eat a cuttle bone? Or why does it eat a mineral block? Because usually that is a body's, I guess, message to the bird, to the brain, to look at that mineral block and say, or cuttle bone and say, eat it, because we need calcium. And so that is what happens when you go like, why would it eat a mineral block? Why would it eat a cuttle bone? You know, what tastes good about that? Why would it want to? It's because the body is saying that that's good, and so it does. And so that may be something going on here. But I would do, you know, what your thoughts are. Is it bad? Yeah, I don't think that it's good for the bird to eat soil. It's good that the bird gets out and goes around. I encourage that, but I would do something so to prevent the bird from eating that soil. If you're concerned about what the nutritional status is of your bird, we have talked about vitamin and mineral supplements. And I know Lafeber, Vivi13 is one of their products. Since they're sponsoring this webinar, I want to mention that. Necton is another company that has good vitamin and mineral supplementations, Nekton. And the Lafeber product is Vivi13. And I know that they have that. So that's my thoughts. Yes, try to prevent it from eating the soil, because it's not necessarily aspergillosis that I would be concerned about, but you don't know what else is in potting soil that may be possibly toxic, or if ingested. And it appears that the bird is really likes this. So I would prevent it from getting to it.
Okay. And then Jane wanted to know if there's any drawbacks or potential health issues of giving meloxicam for the long term for a budgie that has arthritis.
Some potential side effects. That's a good question. I'm not one to really promote long-term use of any medication. Again, I'm not one to promote it. However, there are cases where long-term medication is needed to provide a good quality of life for that patient. And so there are particular instances where it has to be given. Being aware of the potential side effects is needed, so that if any occur, that you can possibly look at, stopping the medication for a period of time, letting the bird recover, and determining how long that would be most effective without actually getting to the point of side effects, that you could treat the bird. Possibly you could, treat it as needed. Treat it, the bird gets better. Okay, we'll stop treatment for a few weeks, see how it does, and then if it starts to look like it's having problems again, start treatment again. Just as needed for a few days to see, like you had a headache. Well, I have a headache. I'm not taking aspirin every day or Tylenol or Advil every day, just taking it as I need it. And that could be something similar that you do with the bird. But if it does need it every day, then it needs it for the quality of life. And the side effects of meloxicam can go from any type of gastrointestinal side effects, possible renal side effects that affect the kidney. But with long-term use, we have seen minimal of those side effects. And you can look online to see what some of the side effects are of meloxicam. But what's nice about this, you can see what the side effects, learn about the side effects of meloxicam and NSAIDs and COX inhibitors, which is one of the classifications of meloxicam, what they can do. But then what's beneficial about the webinar, and asking somebody that sees and treats birds, and some of them with long-term use of meloxicam, what's the side effects that we see? And I'd say that we see few of these side effects, but again, each case is individual. And so while all of a sudden, what the side effects are, you're seeing it in your bird, and you go like, I was on that Lafeber webinar, asked the vet, and Dr. Tully, he said, oh, we don't see side effects, but I've been given this for a week and I'm seeing side effects. That's what happens when you have the individual cases from time to time. Yeah.
Okay. And so then Diane wanted to know, Diane has a 6-month-old pied cockatiel. Is it too early to trim his nails? And if so, what age is reasonable for a nail trim on a cockatiel?
Well, what I would say usually is what I say with the small or younger birds is that I like to make sure that they get to where they are able to perch and can get around well. So after, I would say the first nail trim should not be done until the bird is able to perch. Okay, and so that would be when it is fully weaned and up and around. Okay, you want those little sharp claws to be able to keep those legs under it so it doesn't splay, they don't splay out. So that's what I would say. Now, with the nail trim, there's one thing that you always should remember as it relates to the birds that are brought in, that when do you do it? Some birds you don't have to do nail trims on. They'll go their whole life and never have to have a nail trim. Other birds, those claws just grow and you have to get them trimmed. The other point, maybe it's not because the claws or the nails are too long, it's because they're sharp. And you look like you've been in a fight with a barbed wire fence. Yeah. And so you need to get the nails blunted a little bit. And so those are the two reasons. But if they're not long and they're not causing really lacerations on your arm or on your body, then they may not, the bird may not have to get the nails trimmed. So that's what we look at. And then people always ask, well, doctor, well, how often do I need to do it?
Yeah.
And so for birds that, and usually we see this in macaws and cockatoos, where the claws grow extremely long, and they can grow long and never form a point on them, but they'll have a blunted tip and they'll curl all the way around. And I just call that macro Velcro, where they'll get it hooked into the cage and they can't get it out. Okay. And can rip off their claw. So you really, it's very beneficial, and they can get it hooked into the bottom of the cage and they can cause trauma to a joint or something like that. So those claws need to be trimmed if they are, get extremely long, and that usually is when you're looking and you see a curl, because the claw shouldn't extend really past the bottom of the foot.
Okay.
And then the other point is that and no pun intended, is if the claw is very sharp and it's a sharp point. Well, when you start getting scratches all over your arms or something, or it hurts when the bird's there, you know, you don't want to discourage somebody from interacting with the bird. So at that point, when that time is when you get the bird claws trimmed.
That's a good point, because then, especially if someone's kind of new to birds, they feel that point on their arm and they might throw the bird, they might make it so the bird flies off by the ground.
Yeah.
So
Yeah.
I've had some pointy nails on my arm, and it's painful sometimes.
It's just, I call them little talons, you know, it's like, you know, and so it's, and you surely don't want to be discouraged from interacting with your bird. And of course, if it's painful, then that is a discouraging effect, you know.
Good point, as you said earlier. Pun intended. I've got a question from Danelia. So during the last annual exam, the vet discovered the 7-year-old female Pyonis had a slightly thickened crop and intermittent polyura. Let's see, and almost 10% weight gain for the first time in 7 years. And then also the bird regurgitates, like a relaxed, no straining kind of regurgitation after meals for about 3 years. And the vet decided not to do an invasive procedure then. This is 3 years ago. Bird doesn't regurgitate on perches, toys, or me, just sits and chews even if I don't pay any attention to her. So what could be causing that? And should she insist on getting additional testing?
Yeah, that's good. It appears that you have a very thoughtful veterinarian there who's you know, trying to assess the condition of the bird and make sure that there's judicious recommendations as far as diagnostic testing goes, where it's not like, well, we got to do radiographs, a CT, MRI, and you know. And so it appears to kind of looking, obviously the bird is eating and the digestive system is working because it's gained weight. So the body condition is increasing. And how old was this bird again, Laura?
7 years old.
7 years old, a Pyonis. And so some of the issues, the regurgitation, it would depend on how it's progressed. Sometimes a single bird, it could be related to something it's eating that may be irritating the crop, mainly in budgies, but it may occur in other birds where there's regurgitation. It depends on where and when the regurgitation occurs. It could be related to, I'm just going to throw out some different, things that you're, looking at as possibilities, to just behavioral interaction with people or other birds that it likes. Regurgitation can occur. If it gets your attention, then the bird may learn that if it regurgitates, you're going to come see it. Hello. And so that may be something that it's a training mechanism for the bird to get you to come to the cage. And then also, and you wouldn't think with this time period, you're talking about 3 years, that there would be any zinc, high levels of zinc or anything like that, but that could cause regurgitation also. Over and above cancer, which the bird is gaining weight and seems to be doing well. So over a 3-year time period, you wouldn't think that, but that will cause regurgitation. And then also a infectious process. We call it ingluvitis. The ingluves is the crop. So the ingluvitis that would be associated with a bacterial infection, and possibly a secondary yeast, candidiasis. They call it sour crop, but you may not have a full blown sour crop, a full presentation where the crop just becomes static or stasis. They call it crop stasis. What may be associated with, like I said, a bacterial and or secondary crop yeast infection, candidiasis. So with that, you have the bird examined. You look at the complete blood count to determine if you have inflammation, kind of a systemic inflammation that may be associated with a bacterial infection. And so that's what how you can look at that to determine if there may be some irritation causing that regurgitation. But that's kind of the big picture of what the regurgitation is. But at this point, kind of look at some of those things to see if that may be possibilities. But otherwise, the bird appears to be doing well, and it doesn't appear to be getting worse. So then you kind of go into behavior, then you go into nutrition, not what it's the intake of nutrition, but something that it may be eating that's irritating that crop, causing it to regurgitate.
Okay. And let's see, what's our next question? Okay, so SG has a 30-year-old, almost 30-year-old Nande conure that seems to have some vision loss. The vet have noticed that he does not seem to see as well as he used to. The only thing that the vet has found in his eyes are some spots on the cornea, though he hasn't suffered any injuries in the past that could cause those. Do you have any insight on what could be the cause of the vision loss in the older birds and the best way to help them cope with it?
Yeah. The coping it would be similar to what we're doing with our Yorkie that's older and has difficulty seeing. The causes for vision loss in birds are primarily in older birds, and a 30-year-old Nande is a very old bird. Okay. I would say that your conures, you'd probably be looking at 20 to 25 years as the average life expectancy, although you can see that they can live longer, and hopefully you have much longer to live with have your Nande conure. But it gives you an idea of some of the geriatric changes that occur in birds, and they do occur. And these are the geriatric changes that we look for. If somebody says, "Hey, Dr. Tully, how old is this bird?" Well, if it's a middle-aged or young bird, a younger bird, it's very difficult to tell once they're over a year old or 2 or 3 years old. It's very difficult to tell. Of course, before they're weaned, there are different things that you can tell most people that this is a less than a year bird or what have you. But when you get older, you can say, yes, this is an old bird. You can't tell exactly what age it is, but you can tell that this is an older bird. And what causes the eye issues are not necessarily the corneal lesions, although in a long, well-lived life, most animals will have corneal lesions when they get older. But what causes, and for the most part, they're not going to cause any sight deficiencies. What does cause sight deficiencies are lens opacities, cataracts. Most people are familiar with cataracts. That's a lens opacity. It just loses its it's I guess what happens, it just gets old and it's non-pliable, and so the lens opacities build up through the aging process, and to the point where it makes look, seeing difficult. We have some birds that'll get on the side, older birds that'll look, through the tilt their head to see, because they can see better that way. It's not something that's necessarily a disease problem, but it's just that's how they can see better. So I would say that what's causing your bird to have difficulty seeing is lens opacities, or just say cataract formation. And so that's my thoughts, and that's very, very common in older birds. Then you go like, well, what can I do about it? Birds have kind of an interesting anatomy to their eye, and they're very small. And your Hernandez conures eye is very small. So ophthalmologists, of course, use operating microscopes to do ocular surgery. Thank goodness, so they can do it well on a very, very important part of our body or the animal's body. But in bigger birds, macaws, I know in some parrots, I can't recall, and I know wildlife like owls and different raptor species, that they've done lens extractions to remove the cloudy lens so the bird can see. Of course, it doesn't see as well as if it had a viable lens, but those surgeries are done. But for the most part, making sure that the bird is in an environment that it's familiar with is the best thing that you can do. The cataract surgery, like I said, is not something that that I've heard done on conures. But if somebody has a bigger bird and would like to inquire to a veterinary ophthalmologist about lens extraction, that's been published and it's been performed successfully. However, I just want to add, lens extraction in general, anybody that's had a dog that's looked to have the lens extracted will know that you're looking at between $3,000 and $4,000 per eye for the surgery. So it's not a cheap surgery to do by any stretch of the imagination. But in the meantime, like I said, just again, making sure that the bird's in a familiar surroundings, that it's used to those surroundings, and that it's comfortable in those surroundings, and that you'll find that the bird will have a fantastic quality of life.
Right. And then our question that's from Pam is Cuttlebone still a recommendation for pet birds?
Cuttlebone?
Cuttlebone earlier.
Yeah.
So she wants to know, would you recommend it for pet birds? So.
Oh yeah, definitely. Cuttlebone, that is a requirement in my book, a requirement. Cuttlebone or a mineral block. A mineral block, they have larger cuttlebones from large cuttlefish. But you always should have that in there, even if the birds, and I say the mineral block because it's harder. Sometimes birds, larger birds will go to a cuttlebone, even large cuttlebones, and they'll just tear them up because it feels good. They're not eating them. You'll see it all, it was up there, and then all of a sudden you see it all on the bottom of the cage. And so that's why the mineral blocks are better, because the birds can shave off those mineral blocks, and they're a little bit harder or more than a little bit, actually. Cuttle bones are very soft, that they can actually just shave off part of that mineral block.
Okay.
So yeah, it should be available. And what you'll find is that you may have a mineral block or a cuttle bone in there for years. They're not going to again go bad, if you want to call it that, or expire. There's not an expiration date on the mineral block, but if there's if it's impregnated with vitamins and minerals, then there may be an expiration date on that. But if it's just a calcium supplement, the calcium will remain. It's not going to go bad per se. But on a strict mineral supplement, such as something like that, I still would change it out in 5-year period or so.
Oh, wow. Would that be the same if, like, say your bird likes to bathe in its dish around the middle, like it gets wet constantly? Is that something that would maybe require a quicker switch out? Can it get wet?
A quicker switch out of,
like if the mineral block is getting like constantly splashed by water.
Yeah. I think that you should kind of assess the quality of it. If it's, and if for some reason it's soiled or what have you, then it should be changed on that. They're relatively inexpensive, but it is a calcium source that is important for the birds, and that if they're not getting enough within their diet, then that's one thing that if they need it, they can get it. And that's always nice to have.
And would that be especially so for egg-laying birds, for the hens?
Yes. It is extremely important for egg-laying birds, and sometimes we'll have birds where we do x-rays and perform x-rays on the birds to see what, if they have an egg in there or what have you, or female hen, and we'll see the ventriculus full of the mineral block or the cuttle bone, and so we don't recommend grit to the parrots, because in some birds we do. If you have racing pigeons, well, we would recommend that you buy a commercial grit, which is basically quartz. That has no nutritional value. That's just a mechanical device in the form of a rock that the birds ingest to grind up the food in the muscular stomach or ventriculus or gizzard. All of those are interchangeable terms, but nonetheless, for our parrots, we don't recommend putting sand or anything else down in the bottom of the cage for them to eat. They chew their food to a certain degree, and the digestive system works well. So the clay or the mineral block, the clay block, the mineral block, the cuttle bone, they are nutritional supplements in the form for calcium primarily. Now there are some that they cast into like grapes or orange slices, and those are mineral blocks that may be impregnated with more than just calcium, and those are the ones that I say may expire. They may have an expiration on them, and you should look at that.
Okay. Yeah. And now we have a question about motion sickness. Actually, two questions. So what can you do for a cockatiel that gets motion sickness on long drives? And is motion sickness in cars common in parrots? They have a conure and a coyote who exhibit this. And is there a solution for motion sickness?
Well, that's I haven't had that issue. There's it's interesting that both birds suffer from this, appear to suffer from it. My first question, I guess, is what are the birds exhibiting in motion sickness? What are the birds exhibiting? And why is that the kind of the thought that is going into it? The thought going into it, well, I put them in the car and I drive and they do this. Now, what is that they do, and how often do they do it, and when do they do it during the drive? Is it after you go 50 miles? Is it as soon as you put them in the car? Is it, because that'll have a lot to do with determining, what's going on here. It appears that they're fine at the house and do well, but when they get in the car, but I don't see that in birds very much. I do hear when, they get in the car, they do associate, if they never get in the car and they come see a doctor, well, that's something that may stress the birds a little bit, because I'm not going to be able to do what I want to do. People get stressed going to physicians, and some people get stressed to the point of becoming ill doing that. We had one time there was a dog that came into the clinic that I was doing relief work many years ago, and every time it would come in the front door, it would have a seizure.
Wow. But
if it came in the side door, it wouldn't. It was going into the front door when this occurred. Yeah, every time. And you say, well, how many times did you abuse that little poor dog to come in? So let's put it this way. After about the second or third time, it was like, let's try the side door every time. So it wasn't, when I say every time, we only let it, the first, after the first, probably by the third time, it was like, always come in the side door. So that may be something that, if it starts right away, but if it's over a longer period of time, there are some possible medications that can be used for sedating the little birds or something like that. If it is a significant problem, it could be, did you say motion sickness or what have you?
Yes.
If they travel on a plane with the birds or what have, so there are some things that can be utilized, but it would just be dependent on when, how, where, what happens with it. But yes, and it's not something that we see that often, or any of the patients are presented with. But interesting question, a very good question. But it does point to the fact that birds, if they don't get in the car and they only go to the car for the veterinarian, they'll remember, like, well, they held me when I didn't want to be held. They, opened my beak, and so it's not something that is what they would put at the top of their list of things to do.
Okay. And so I've got this interesting question from David regarding his 19-year-old male white-faced cockatiel. His question is about inbreeding anomalies and variant colorations. So his 19-year-old male white-faced cockatiel has a great disposition, bright-eyed, sings a lot. When he got him, the vet told him that he didn't expect his life to be too long. And after he blew past 10 years, he felt now he's in the bonus years with him. So the cockatiel is affectionate and sometimes has nesting behavior, like cuddling in a corner. And then It looks like he sits in a corner in a depression on his litter as if it's an egg. However, unlike other teals that David has owned since 1978, he has never registered his reflection in the mirror, which is, I mean, especially male cockatiels, right? You know, what male cockatiel doesn't like his reflection in the mirror sometimes. So nor does he get aggressive. So he was hand-fed as a baby and shows more interest in people than other birds. He has displayed polyuria and watery droppings during the last 2 years, suggesting kidney disease due to age, but otherwise is active and eats normally. He's been raised all of his life with seeds and Lafeber maintenance pellets, which I attribute to his long life, which David attributes to his long life. But the reflection thing is perplexing him. So any thoughts on that?
Well, I guess with the cockatiel color mutations, that it's sometimes difficult to sex the birds on that. And I can tell you, I had a cockatiel color mutation that I was given to by a very, a very good aviculturist. I mean, as far as the, was raising cockatiels for many years. And so one of the cockatiel mutations, I said, I had a female cockatiel. I want to, and it passed away. It died. I want another bird. And he said, "Oh, I'll get you a bird." So he gave me. He said, "This is, after I get through pearl, pied, Latino, the cockatiel color mutations have just gone into orbit, just like a lot of other birds' color mutations. So it's difficult for me to keep up, and so he gave me this bird, and he says, "Oh, I have a male." And so I had female cockatiels for the most part, but I've known and worked with aviculturalists for years on cockatiels, and I remember one told me that it was very difficult to tell the dimorphism between the difference between a male and a female cockatiel that was heavily pied. A heavily pied cockatiel, it was very difficult to tell between a male and a female, and that the way he did it, he would just set the heavily pied birds up and he'd watch them, and the males would act like males, foolish and vocal, and the females would be very reserved and kind of laugh at the males without saying anything. Okay. And so he could tell the difference between the males and the females very quickly. Well, I had just had a female cockatiel, and that was fine. And this cockatiel aviculturist, he gave me this, what he said was a male. Well, it didn't act much different, but I said it's a male, but it was one of the color mutations, and so kept the bird. At about year 7, it laid an egg. The male laid an egg, and so that I'm not, and it was 7 years, 80 years into owning the bird before it laid an egg. So I'm not sure if it's definitive that this is a male, or by through the color mutation you can say, yeah, it has bars on the wing, it's definitely a female or a male, but it doesn't, so it's a male. But that may, the bird sounds like a female to me in behavior. And although it's never laid an egg, it doesn't have to lay an egg, and if it is a female, bless you. But then I get a male cockatiel, and the difference between the male and the female, and then you probably had male I mean, they just never shut up. Male cockatiels just never shut up, and females are much more reserved. Now, if somebody's, coming within 100 yards of the house, that female cockatiel will go, it'll let you know. But the male is always going. So with that in mind, that's one of the things, unless you say, oh, this is, coloration. And of course, there could be some hormonal or something in there, but it just sounds a lot like a female to me.
All right. And then Chris wanted to, they moved to an area that gets really cold in the winter. And she's heard that she's bracing for some potential power outages that can last up to 2 to 3 days. So Chris's house has a fuse box that cannot handle a generator. Any suggestions to keep the 2 parrots safe should the power outage happen when it's cold?
Well, I don't know what type of parrots they are, but if they're in the house under normal circumstances, unless it gets below, and with no power, the way that I would do it probably would be like they do it in zoos, or with a heat lamp, 100-watt bulb, or a ceramic heat bulb. You put it in one of the reflectors and put that near the cage, and that should keep that. The parrot could go up to that, but then again, you said, but I have no power.
Yeah.
Am I going to be riding a bicycle to make that little element go? Then if so you have no power, and so that will not work. Strike.
Oh, by the way, sorry, it's an African gray and an Amazon parrot.
Okay. What I would do is try to do some proactive communicating with your somebody within the local area that may have a generator or something that would be able to hold the power, hold the animals until you're able to get power back. That's what I would do. That's the only thing I think that you can do in that situation. If you don't have good ventilation, if you have a wood stove or something like that, then that has good ventilation, you don't get a lot of smoke in the room, but that's always a potential. And then you don't have much time to react if that happens. To be safe, it would be to try to move those birds to someplace that has generator power that can either maintain a heat lamp. I mean, they don't have to go in the house. They can, but possibly in some type of an outside room, because when you say cold, I'm thinking cold now. That these birds are going to need to be inside with that type of cold weather.
Okay. And I think you touched upon in an earlier webinar that, they can acclimate, birds can acclimate to colder, but I imagine first winter would probably be a harder winter for them to even handle like a cold snap, right?
Yeah, I mean, they can acclimate, and and if parrots are outside in 40-degree weather, 30-degree weather, but they've acclimated and they have the feathering to keep them warm, as long as they're out of the elements. There's no rain or sleet or what have you on them. I've seen pictures of parrots in the snow and stuff. You have too, I know, Laura. But they need some place to to go and get a little bit warmer. And in those type situations, you can put a heat lamp or something on if you have power. But in these type situations, you have an ice storm or something like that, where you have no power. You know, you're talking about the inside of the house getting as cold or colder than the outside of that, and, you know, the environment. So that's why there's only one option, and that is to find somebody with a generator that would take those birds at that period of time. And keeping this in mind, you won't, you know, you have to say, it's coming, and I need to get them there before it gets here, because I may not be able to get on the roads to get them to you. So you have to get that, you know, set up, and the birds being able to move if something like that's coming, because you may not be able to get on the road at that point.
Good point. Good point. All right. And then we have a question from Sharon about epilepsy or seizure disorder. Are they uncommon in parrots? How can you tell the difference between a seizure disorder and versus seizures caused by atherosclerosis? And how is early kidney disease treated? Those are Sharon's questions for you.
Well, seizures are not uncommon in birds. We see seizure activity in birds, and when you're looking at seizures caused or issues that are associated with atherosclerosis or neurologic deficits that where the bird can't stand, that is the ones that we see there are usually associated with the bird becoming getting the blood pressure increasing. And so where that happens, you don't get blood flow because the blood pressure increases, the blood's going at a higher rate through the vessels, but they are not they're closed, you know, they're clogged up, as we say down south. And so the muscle doesn't get the blood flow, and then they have a difficult time actually perching and may not be able to perch, and it appears seizure-like. Also, atherosclerosis can cause strokes, and so if you have where the blood isn't going to the brain, an ischemic area of tissue where that causes damage to the brain, then atherosclerosis can actually cause seizure activity in birds long after the stroke. And then also trauma, the same things, basically the same things that cause a seizure activity in humans can cause it in birds, and we've seen it. Tumors can cause seizure activity in birds, particularly budgies can have that. Strokes, we've identified the stroke. Dr. Beaufrere, when he was here, had a bird, Natasha, that actually had identified the stroke on an MRI. And had seizures and was treated for seizures for years afterwards. The medication was very helpful in reducing the onset of those seizures. So they can be treated. But of course, if there's a pituitary tumor in a budgie, that's not going to be that's not going to be a treatable, at this point in history, a treatable disease process. Hopefully in the future it will, but that's the situation. Epileptic, you say, well, what about epilepsy? You know, idiopathic epilepsy. That's idiopathic means, anybody says idiopathic, that means I don't know. Idio. Think of that, idio. Idiopathic means I
Mind-blowing.
don't know what causes it. So when they say, that's an idiopathic epilepsy, well, that's seizure activity. And sometimes when you see seizure activity like that, it is a very rapid onset for a short period of time, and then it takes the bird a little bit of time for it to recover. Post-ictal phase, they call it. And so that's something that can occur, but then we have to find out what the possible causes of those seizures are. And we can have seizure activity with hypocalcemia. And so that's what we're, so we do see it, but there's many forms, and kind of somewhat a little bit different with atherosclerosis, but atherosclerosis can be, and that is where just clogging of the arteries, okay? Just like humans can get that and have heart attacks, right? When they have vessels in the heart that are affected. So, yeah.
Wow. Well, believe it or not, that is our last question. We're all out of time today for another question, but the good news is that you'll be back with us in December, on December 17th to be exact, for more questions for you. And I don't believe you have a homework assignment this time. No one stumped you this time.
No. Well, that's good. But we had fantastic questions all along. I mean,
absolutely.
It's just wonderful.
Well, I think I speak on behalf of a lot of our participants, but very thankful, going for the thankful theme because next Thursday is Thanksgiving. Very thankful that you take your time on Fridays to answer these questions for people. So I know I'm thankful that you're on with us, and I imagine a lot of our participants are. So.
Well, and I'm thankful that I have the opportunity, and am able to work with you and Brenda and Lafeber, and have fun, and thankful for having that opportunity.
All right. And on that note, I'm going to announce today's winner of our giveaway. And we're getting all these thankful. This is really touching. All these people saying thank you very much in the messaging. So
that's nice. Very nice.
So Shelly Arch, you are a winner today of our giveaway. So congratulations, Shelly. Maybe your bird will enjoy snacking on this when you have your Thanksgiving feast next week. It is you're going to get a bag of Lafeber. I believe it's classic nutri-berries. I'm going to play the video that Dr. Lamb sent of her Amazon Arroyo enjoying today's product giveaway. So I'll show that in a second. I just want to give us a really quick sneak preview before I hit the click button on the video. So in December, so we're going to take a break after today, come back first Friday in December, December 3rd. We're going to do Avian Vet Insider with Dr. Lamb. The topic is what's wrong with that bird. She's going to, if you like to geek out on avian vet medicine, you want to join us. It's on rare and fascinating avian medicine cases that she's seen and treated. And then a very, very exciting webinar after that, December 10th. We're going to do the Gray Way with Lisa Bono, but it's going to be a fun holiday gift guide giveaway. So it's going to be intermixed with giving away actual products that people are really going to be wanting to hopefully have a chance to win. So you want to join us definitely for upcoming webinars in December. And again, we've got you back on December 17th with Ask the Vet. On that note, I'm going to play the giveaway video because it's really cute, and hopefully this will play proper. I'm always crossing fingers when I play share screens. So here we go. Let's see. Okay. Why is it not showing? Okay. Let me try one more time here. Okay.
I think you have it.
There we go. Okay, I'm gonna hit play.
I was so grateful this year for Thanksgiving. He's getting to celebrate.
Oh shoot, I got a double play.
Classic nutri-berries. He's getting
sorry, hang on a second.
Thanksgiving.
Okay.
Eating some classic. Pretty delicious.
Is it doing it again? Stop.
Those are pretty delicious, aren't they, Roy?
Okay. She's got a nice Thanksgiving spread there. I want to show that, but Arroyo is showing us how much birds like the classic Nutriberries. That was a cute little Thanksgiving setup that she created. So that's our giveaway for today. And I want to thank everybody. Again, I'm gonna use that word. Thankful for you, Dr. Tully, for being on with us on Fridays for Ask the Vet. And everyone have a wonderful Thanksgiving next week. All the best to you and your birds, and everyone. Until next time, everyone stay safe. Bye.
Bye. Thank you.